want to talk to you guys about feline leukemia testing in shelters.
So this is just an overview of what we're going to talk about today. First, why should we test for FeLV in shelters? What cats should we test? Ideally, we're going to test all cats, but sometimes we need to target our testing to individual populations. What type of FeLV tests are there? I'm sure you guys are familiar with a lot of them, but we're just going to go over when we should use these tests. This is a topic that gets a lot of questions, testing kittens. So hopefully I'm going to answer those questions for you. How test results correlate to disease progression is an important thing to talk about, and whether or not we can trust our results. And then if you guys are adopting out FeLV positive cats, what adopters should know about this disease. So, you know, as with many things in shelters, you guys come from an array of different organizations, and because of this, the protocols are going to differ, and that's fine. It's going to differ based on your mission. So if you're an open admission shelter that has limited space and is euthanizing a high number of cats, you're going to have a totally different protocol for FeLV testing than a shelter that has selected admission and attempts to adopt out every cat. The Asilomar Accords are going to come into play, so if FeLV positive cats are unhealthy, untreatable, it's going to be a different story than if they're treatable, manageable. Resources. By this I mostly mean money. So money when it comes to retesting cats, money when it comes to having the ability to keep a cat in a cage for 2 months while you wait to retest it. And then staff. It would be nice if we all had expert blood drawers of cats in our shelter, but unfortunately some shelters don't have that ability. So sometimes we have to wait to have blood drawn, and that can create a bottleneck as far as moving cats along into communal housing. And then housing, communal housing, these guys really should be tested before they're in groups. So that's going to play a part too if you guys are using communal housing in your shelter. So why do we test for FeLV? And a lot of you guys probably know this, but FeLV is a contagious disease, and it has some bad consequences. So cats that are infected with FeLV have roughly a 20 times greater chance of getting cancer, and it's usually lymphoma. These guys get blood disorders, and they also have a weakened immune system. So for a cat in a shelter setting with a weak immune system where they're exposed to a lot of different bugs, you can imagine this can be a challenge for them. Many cats will develop these secondary diseases, and usually they develop them within 3 years of diagnosis, and about 80% of these cats will succumb to their disease. So when we talk about shelter medicine, we really have to think about our cat almost as a herd, like we would think of cows, right? So testing for FeLV protects our population. So by testing that one cat, we're really protecting all the other cats that that animal is exposed to. And we're also protecting our adopters, because our adopters want to know if our cat might get a really bad disease within 3 years, right? Okay. So what cat? I know, I love that picture. I think I Googled cute cats, and that came up. All right. What cats should be tested? So in an ideal world, we would really test all adoptable cats and kittens. But if you guys need to target your testing for financial reasons, we really need to test everybody that lives in group housing, whether that's within the shelter, so in a communal housing situation, whether it's within a foster home or in an adopter's home. And then if you guys have like a sanctuary setting where you're keeping FeLV positive cats, or you're adopting out cats that have seemingly terminal illnesses or upper respiratory infections that won't clear up, or they have chronic weight loss, those are definitely cats that you want to test so you know their status. Okay, here's the big kitten debacle, right? So a lot of people want to know, okay, can we just test one litter or one kitten within a litter? Another question that we commonly get is, can we pool samples from 4 different kittens and use that on one test? And the answer to that is that it's really less than ideal. And the reason for this is because we have this lovely little FeLV positive mom with her 2 adorable kittens, and this kitten can be exposed in utero, so in the uterus. It can be exposed from milk from the mother, and it can also be exposed saliva from grooming after the kittens are born. This kitten immune system will not clear the virus always, so these kittens will become FeLV positive. Adult cats have a lot easier time clearing the virus than kittens do. However, some kittens' immune system will kick in and clear the virus. So you can imagine with this situation, you can have some kittens that are positive and some negative within the same litter. And then for some reason, an FeLV positive mom might not expose any of her kittens for some reason, when they're in utero. So all of these guys will be negative. So a really important take-home message here is that just because you have an FeLV positive mom, it doesn't necessarily mean that the kittens are exposed, okay? And another important point is that just because you test one in a litter and it's negative, that doesn't mean that all the other kittens are. So ideally, we're testing everybody. And I know this can get expensive, but this is just the science, just so you guys understand. Yeah? So the question was, will the kittens be continuously exposed to an FeLV positive mother, from saliva? Yes, they'll be continuously exposed. So ideally, we would remove them from their mother if you have the resources to bottle feed, which I know is really fun, but I know. Yeah. The question was, what age can we start testing these kittens? This is a good question. Some of them will be positive right off the bat, but some of them can take a while, and we'll talk about this when we talk about retesting and everything, but it can take up to 12 weeks for them to seroconvert or become positive. All right, so what kind of tests are there? I'm sure you guys have a lot of familiarity with these two. I'm calling these point-of-care tests, in that you can have them on the counter beside you and get a result. Basically, a color change means a positive result. I'm sure you guys have all seen these. And these test for particles of virus within the blood. So it's actually testing whether or not that animal has virus in the blood. And this is very different from the FIV test, which Dr. Putney is going to talk about after me. These are about $10 to $20 per test. And these require blood, either in the form of whole blood, serum, or plasma. We really don't recommend using tears or saliva because the accuracy really is not as good with these methods. So try to use the blood. So then we have confirmatory tests. And confirmatory tests are those that are used after you have a positive test on your point of care test and you're using to confirm whether or not that cat is actually positive. So you can use another point of care test, so like the SNAP test or the HESCA test in 60 days. A lot of people will say, why don't we just run another point of care test right now and see if it actually is positive? That's not the best idea because it's testing for the same thing, right? And it's probably going to make the same mistake. So you're kind of wasting money by just running another test at the exact same time. And then you can run a fancy test that you send into the diagnostic lab. This is called an IFA, or immunofluorescence antibody test. The cells here, okay, in the bottom right-hand corner, you can see that those cells are fluorescing, and basically that's an indication that there's virus within those cells. These are about $30 a test, and these are done immediately, so you can draw the blood right after you get a positive and send it in. And this will indicate that the bone marrow is affected, which typically means that the cat is persistently infected. Okay, so now we're going to talk about the pathogenesis of the disease. So pathogenesis just basically means how the virus creates disease within the body. So a cat is exposed to FeLV, usually by saliva. Adult cats mostly get it by saliva, but blood, urine, and feces are also other modes of transmission. 30% of cats will have virus multiply in the bone marrow, in the salivary glands, and in the lymph tissues, and these will become persistently infected. So these are going to be positive on your point of care test, which is your SNAP test or your HESCA test, and they're going to be positive on your confirmatory IFA test because the bone marrow is affected. Then we have a regressor category. These are about 60% of cats. So 60% of cats that are exposed to FeLV can clear the virus, right? So these guys are going to be negative on the point of care test, and they're going to be negative on the IFA. And then we have this really annoying category in the middle that I'm sure a lot of you guys have dealt with. They're the atypicals. This is about 10% of cats. They'll have virus in the blood it can be up to a year. They can have virus in the blood, but it doesn't go to the bone marrow. So these guys are wavering between this regressor category and persistently infected. And usually these guys will go into one of these categories, But the problem here is you have discordant results. So you have a positive SNAP test, but your IFA is negative. So these are the sticky situations where if you guys have questions, feel free to contact one of us. Yeah. So the question is whether the atypical or regressors are carriers of the disease and can infect other cats. Because they have virus in the blood, the atypicals, yes, they can affect other cats. The regressors, typically not. Yeah.
When you state the immune system clears.
So the question is, for the regressor category, when the immune system clears the virus, is it completely clearing it, or is it like dormant, hiding in the body somewhere to come back later? And the answer is that the immune system completely clears the virus. So these cats are negative unless they get re-exposed by somebody. Does that make sense? Yes. Yeah.
Okay, when you're testing, say if you were testing.
So the question is, if you have blood on your hands between drawing blood for kittens, should you wash your hands between each kitten? I would say yes for a variety of reasons, but yeah.
Okay, and then if you had, say, lick each other.
Yeah, so the question is, basically, is blood, when it's outside of the body, is blood infective to other cats? And it can be for up to like an hour or two. Mm-hmm. So, but not that, it's not like persistent in the environment. Okay. Yep. So the question is, if you have a mother that tests negative for FeLV, should you test the kittens? And the answer is yes. And the reason is because the mother could have been exposed to FeLV, had it in the blood, transmitted it to her kittens, and then cleared the virus. Do you see what I'm saying? So this is just another way I wanted to represent to you guys how testing for FeLV. This is sort of on a linear time scale. So up here we have time, and then the different events that happen during the pathogenesis of the disease. So we have FeLV exposure, and then usually in less than 60 days, the cat will have virus in its blood. Okay? Then typically in less than 60 days, the virus will be in the bone marrow, and these guys are the persistently infected cats. So your point of care test is going to be negative until you have virus in the blood. So you can imagine that if a cat comes in and gets tested before there's virus in the blood but has been exposed to FeLV, that cat's going to test negative, even though it might become positive at some point. Okay? And then the IFA result, because this is our confirmatory test, is testing for virus in the bone marrow. These are going to be only positive once it's in the bone marrow. And then can the cat still clear the virus? So up until the point where the cat has the virus in the bone marrow, yes, the cat can clear the virus. Okay? So if you're testing and the cat's positive and you get it in that 60-day window between virus in the blood and virus in the bone marrow, and it's positive, that cat can still clear it. So this is, one of the limitations of the test, that we're testing at a point in time. Okay, interpreting test results. I know, I love this picture. Okay. No test is 100% accurate, and interpreting these tests can be really frustrating. And like I just said, testing at a particular moment in time has its limits, because a cat can subsequently clear the virus, or the cat may not have virus in its blood yet but has been exposed. So when appropriate, you guys can run a confirmatory test like we talked about. And so if you have a cat that looks suspicious to you and it's negative on the SNAP test, but you're like, oh, this cat kind of speaks the picture of FeLV to me, maybe thin, has big lymph nodes, chronic upper respiratory, run a confirmatory test on these guys. It's never wrong. And then if you have a positive cat that's really highly adoptable, you can choose these cats to run an IFA on and see if their bone marrow is affected. And then versus FIV, which Dr. Putney will talk about, vaccination does not interfere with the test. So if your cat has been FeLV vaccinated, that does not affect the test. So can you trust a negative test? And for the most part, yes, and it has to do with the concept of prevalence. So prevalence basically means the percentage of cats in a population that are positive for the disease. So in healthy cats in Ithaca, in most areas, the prevalence is about 2%. So because of that, a negative test can usually be trusted. But remember your clinical picture. If you're not trusting what the test is saying, it's okay to run a confirmatory test. So what if you guys get a positive test? Because in healthy animals, the prevalence is so low, a positive test on a point-of-care test in a healthy cat has a reasonable chance of being a false positive. And by false positive, I mean a cat that tests positive but does not have the disease. So given your mission, and we understand that everybody comes from different places, right? You can run a confirmatory test, like we talked about, one of these options. You can select your highly adoptable cats for a confirmatory test, or you can euthanize FeLV positive cats. So what should adopters know? Keep these guys separate. The reasons we talked about, it's a contagious disease. It not only prevents virus transmission to other cats, but it also prevents the cat with FeLV from getting the infections that it's more susceptible to. These guys should go to the vet every 6 months for blood work for the reasons that we talked about. And this disease has a guarded prognosis. Final thoughts. FeLV is a contagious and devastating disease like we talked about. It protects your herd of cats and community cats. And adopters really expect to know whether this cat has FeLV, so we really need to test all adoptable cats. These tests are good, but they have their limits. So recommend every cat that goes out your door gets a test at their first vet visit, okay? Diseases are dynamic. They change over time. A cat can be positive, become negative. Shelters are dynamic. They have a fluid population of animals. So this all adds, confusion to the situation as far as FeLV testing. So, and shelters with basically perfect protocols get in a sticky situation. So if you guys find yourself in a weird situation, you're not sure what the test means, feel free to contact us. And then this is Charlie, the cutest cat in the world. He has 2 jowls the size of grapefruits and 3 legs. And we love him, and you guys should take him home.